We're proud to partner with Bunker Hill Community College, powering Boston's future workforce through access, equity, and innovation in higher education. Thank you for supporting Rooted and the future of public media. Click the link in the description or visit bhcc.edu to learn more. America has a mental health crisis. Since the COVID-19 pandemic, we've seen rising rates of anxiety, depression, substance use, and suicide. But judging by our healthcare system, we're far from handling that crisis with care. Every year, 1.5 million Americans are involuntarily committed to psychiatric facilities. That's 1.5 million people who lose the right to refuse medication, to leave, to make decisions about their own brains. And before you say, but aren't they dangerous? Peep this. People with serious mental illnesses are 10 times more likely to be victims of violence than the ones committing it. The lack of care for people with mental illnesses has ties to, you guessed it, slavery. In the 1850s, the U.S. Census claimed that free black people went insane at rates 11 times higher than enslaved people. The conclusion? Freedom was driving black folks crazy. Essentially, slavery was therapeutic. We've heard that before. Fast forward to the 1960s, black men got diagnosed with schizophrenia at wildly higher rates than white men. Part of that was because 2 white psychiatrists came up with the term protest psychosis to characterize black men in the civil rights movement. One of the symptoms was hostility toward authority. Maybe they should have considered racism as a mental illness instead. Today, black Americans are still diagnosed with schizophrenia at 3 to 4 times the rate of white Americans, even with identical symptoms. Meanwhile, white patients get diagnoses like anxiety and depression, which is more likely to land them in therapy than a psychiatric hospital. Those who are committed are often done so against their will. From there, they can quickly lose power over decisions about their care. In recent years, we have seen some improvements, such as cities sending social workers, clinicians, or paramedics instead of police to respond to nonviolent mental health calls. There's also been a greater emphasis on assisted outpatient treatment, a court-ordered, community-based form of care. The question is whether these changes will happen fast enough to address the mental health crisis on hand. We know the problem. Now let's get to the root of it. I'm Paris Alston, and this is Rooted.
Bunker Hill Community College is inspiring dreams through academic excellence, community engagement, and workforce partnerships. Learn more at bhcc.edu.